Viewers' discretion. Please be aware that the views and opinions expressed by our guest are those of our guest solely, and they are not the views and expressions of the podcast or myself as Madam Speaker and the studios where we are recording. So if you want to come through as somebody who has the right to reply, if the episode is saying anything about you, you are more than welcome to reach out to us. But I want to emphasize that the views and opinions of the guest are solely of the guest and do not represent our channel, our podcast, or myself in any way, shape, or form.
So your age matters. Your work matters. Your stress level matters. Are you sleeping at night? What are you eating? Do you drink alcohol? Let's have a first line, medication, and a second line.
Okay.
First line being just a simple GLP meds, which is what we put you on. Okay. And then second line being a combination of GLP-1 with GIP, which is the one that is popularly being spoken about. Munjaro, tirzepatide, that's the one.
Welcome to the Safe Space Chess Podcast with Madam Speaker. My name is Perseverance Maremeni, also known as Madam Speaker, also known as the CEO of Self-Love. If you're joining for the first time, welcome to the family of healing, self-love, and motivation. And if you're returning, thank you so much for the continuous love and support that you are showing us. We are recording at number 7 Sedgwick Road in Isandoville, Bazalwane. So if you want to come through, maybe you want to start your own podcast or any services including or involving videography, you're more than welcome to hit them up on the number that's appearing on your screen. And also, if you want to become our guest, there are 2 numbers which are appearing on your screen. You can choose either one of the numbers that are there and you can come and sit so that we can have conversations like we're doing today with my beloved doctor. Wait, the doctor is going to introduce herself, ne? Then I'm going to make a confession, guys. I have a confession. Doc?
Hi.
How are you doing?
I'm good, and you?
I'm good, thank you. Please introduce yourself to the viewers at home.
Okay. My name is Dr. Matho Majakane. I'm a medical doctor, general practitioner. I also do aesthetic services.
Okay.
Yes, based in Midrand and Cape Town.
Okay. So for those who don't know, ne, I will be the one that tell them myself, Hori, you are my doctor.
Yes.
You are the reason why I get slender sama catalog. Ne?
Or snatched.
Yes, girl. So the confession that I have is that people don't know that the reason why I decided to start with my weight loss journey is because this one knows. I fell on the stairs. I rolled all the way to the ground from all the way up there, down. Then I thought I was not injured. I went out partying. The next thing I feel, oh, it's wet here. When I go to the bathroom and I remove because I was wearing magusha. What is magusha in English? Pantyhose. I had a deep cut on my leg.
Oh my word.
Take a picture. I sent the doctor of where I was. She's like, ER now. After that, and I remember the only reason why I fell is because I cannot carry my legs. I'm too big for... I'm not saying everybody who is my weight or who was my weight, like my sister was controlling there, cannot carry their legs. But not for me specifically. It was a challenge, you know. And so because of that, I had to make a decision to say, look, I need to lose the weight. So you didn't know about that confession?
No, I didn't. I didn't.
Anyway, please do tell us, Hori, who is Dr. Matho before we even start with you being able to help a lot of us lose weight. Tell us about Dr. Matho.
So, Dr. Matho, born and bred in Limpopo. I'm from a place called Lenyenye, very small town next to Nkowankowa. I know a lot of people know Nkowankowa.
Yes.
So that's where I was born or raised rather. And then I did my high school at a school called Maria. It was like a girls' only school back in the days.
Seems like it's a very famous school, ne?
Yeah, it is. It used to be. I don't know now how it's doing. And then I also then I went to UCT. I did my MBCHB there. Thereafter, I opened my own practice. And after a couple of years, I was like, let me brand it rather than it being dependent on my name. I then called it Clinimed. So that's basically what I do. I'm also a mother of 2.
Yes.
Yeah, so I frequent between Joburg and Cape Town.
Yeah.
Yeah.
So there's somebody at home right now who's thinking it's probably just a touch and go simple thing for you to wake up one day and you're like, listen, because I've studied medicine, I can just open a practice here, and then after a couple of years or whatever, I'm going to open another practice. can you tell us the reality of some of the challenges that you faced on the way?
Okay. So when I finished, I knew or I decided, Uguti, I'm not going back to school. I'm not going to specialize. So I made it clear to myself so that I don't get a bit worried when I see my colleagues pushing and becoming specialists, which is wonderful. But for me personally, I said, baby girl, nalwena rubula business. We are going the business route. First challenge was I didn't have money and I didn't come from rich. So I remember I went to F&B. Sorry to say that, but I did. When I got there, they were like, who are you? Why must we give you like just explain
So much money.
So much money. At that time, it was 15,000 rand.
Yeah.
I still remember. And they were like, no, we can't. So you can imagine the challenges that you have as a person, or rather a young person who doesn't come with the background of money. So those were the challenges of starting my own business. And I think I was asking for an overdraft. They were like, no, sorry, we're not going to give it to you. So you just have to see how you're going to combine it all together and make it happen. So obviously with being patient and building slowly but surely, I think that's why I eventually managed to build what we've built currently.
Yeah. And now when you compare the feel at Cape Town, compared to Joburg, the transition of all of that, how's the difference between the two?
Very interesting. It took me a long time to come and have an establishment in Joburg. Okay. Completely two different business terraces, if I may put it that way. Yeah. Cape Town, we're very relaxed. We're very chilled. Yeah. Joburg, people want results. Yeah. They're results driven.
And they're very opinionated, by the way.
Very opinionated and very supportive. Yes. Very important. Yes. Very supportive. And they recognize you as, especially, I also think because they know and our struggles. So they kind of, feel for you and really genuinely support the business. Yeah. So I'm very much happy, but I still love my Cape Town people.
Ne? That's why really from time to time we won't even see you around here. When did you decide to now venture into what do you call it? Aesthetics.
So one day I was driving to my work, my GP practice in Kailicha. That's where I started the first practice that I have. Yeah. And then I was listening to the radio and there was somebody on there, I don't even remember the name of the doctor, and she was explaining about this aesthetics and blah, blah. I was like, I actually like this thing. What is it? And by then there were very few, if not black doctors in that space. It was predominantly a white space because this is a space where we're talking anti-aging, we're talking weight loss, different services that you can do for weight loss, not just injections and stuff. We're talking laser treatments, we're talking ultrasounds, all sorts of things that we can do for patients to help them achieve their goal weight. So when she said that, I was like, I think I like this. Then I started doing research and I realized, actually, I don't even need to go back to school full time to do it. I can do it. I can do a diploma in it. And then that's what I did. I did the diploma and I just slowly built up on that. But I still run very much the GP services.
Okay.
Yeah.
Yeah, because I was thinking, there are so many aesthetic establishments that I've seen of people who are actually not doctors. Is that a thing? Because now you're talking diploma for aesthetic, and then also at the same time you're a GP. I just want to know how does it work now around that?
Okay, so for me to do the diploma, I needed to be a doctor. Okay, so this is not a diploma that anybody who doesn't,
like the prerequisite is you need to.
Yeah, so it's like doing a diploma maybe in a space where you are in. So I think with all these ones that are coming up everywhere, it's just people using the name aesthetics, not so much that there is a trained or qualified person there, I wouldn't really know.
Okay.
And also because aesthetics encompasses a whole lot of services. But the main thing for me was the anti-aging and the weight loss services. So when we did the diploma, it involved quite a variety of things. And I think that's where it kind of crosses with beauticians and people just opening it, calling it aesthetic services.
Oh,
Yeah.
okay. So they just generalize, they're just putting it under one umbrella.
Yes,
Okay.
yes.
So, Mama Doctor, if I want the working 360 lipo, do you give such services?
No, we don't.
Okay.
This is what I would tell my patients. You need to make sure you go to a plastic surgeon.
Okay.
That can do the service for you properly. We do work with other plastic surgeons that we can refer you to. It's much safer. Remember, with each and every service that you do, especially when it comes to cutting your body and all of that, it's very important that there's litigation and regulations around it. So you need to go to a plastic surgeon. Yeah.
You shouldn't just take chances like that.
Yeah, no, I wouldn't advise you to. Remember, the thing is, especially with the social media, you know, a 30-year-old and a 25-year-old, our bodies are not the same. So if when you can get it done somewhere else and you look good and you're 24 years old and there's no conflict, does not necessarily mean
That
a 40-year-old me can do the same with underlying hypertension, chronic diseases, and all sorts of things. You don't know what you have. The next thing you lie on the bed of somebody who's not trained, and the next thing something else happens. And so I wouldn't advise that kind of, it's not a blanket thing. These things, they are tailor-made for individuals. So, and hence you have plastic people that deal with that.
Like literally that's all they do the whole day.
Yeah, that's what they do. And they won't just start by cutting you. They will take you through a consultation. There will be an anesthetist, which is the doctor that makes you sleep in theater. So all those things are important. I know when we want to look a certain way,
We don't care about a lot of stuff.
exactly. And those are very important things to consider.
Yeah.
Yeah, because now you're talking about your own life here.
And you only have one. You don't have a spare one.
You're not coming back. Once you're gone, you're gone.
Doc, speaking of social media and the power of social media, how has that affected your business?
Look, in a very positive way, in the sense that we able to educate people more, and we are able to give out content that people can listen to and decide, oh, you know what, I think I got this thing. Let me go on it. Let me find out how it works. It has helped us quite a lot. I mean, yes, there's its own dark side of it, it's a learning curve and all of that. But I would say it has made a very positive impact in our business. Yeah.
And how do you receive criticism? Because obviously it's not everybody who's going to be positive when they come on your social media platforms and they want to talk about your products.
Look, I always say that you either learn, you have to learn.
Yeah.
Obviously, nobody wants to be criticized, but I always say that it's important we learn from, is it a genuine criticism? Where did we go wrong? What have we done that didn't work for you? We try and rectify and remedy the situation as much as we can. And where it's a learning curve, we definitely have to up our games, especially, when you're a black business, you're always watched with a critical eye. Which is good in some cases. Some cases it just becomes, but so one mistake, it's like you get penalized for it. Not that we are perfect, and we are open to learning. So I think it's good in that way. So that's how we handle criticism, in the sense that you want to see, where am I going to learn? What is it that I'm going to learn? Am I improving? What's happening here and there? And I also try as much as I can to make it a welcoming space for people not to be shy to say, I'm not happy about this.
Yeah.
You know, so-and-so didn't talk very well with me. And, you know, and we have to be open-minded about it and not just think, oh, they're just criticizing, blah, blah, blah. Yeah.
I think it's very important to always have like a teachable spirit, you know, you can really learn a lot from anybody, you know. But also, you work a lot with familiar faces. I mean, for me to know of you, I knew of you because of Khunzi, you know, because I saw the progress of what you had done with him so much that I also had to reach out and see if maybe we can work together for me to lose the weight that I had on. How is it like to work with Phela? Sometimes when we have our own drama. Phela, we are the best thing that happened since sliced bread, dog. How is it like working with us, people who are here in front of the cameras, compared to an ordinary South African?
Look, I think I try so much to get that first consultation with you, because most of the times I'm not going to be there when you're probably coming in for your follow-ups and all of that. And I also think it's an energy thing. I mean, you know, you're not going to be sweet aid for everyone. There are people that are just not going to be your people. And I think when it comes to who we work with, it's also the relationship that we try and build with the clients, if they are open to it.
Yeah.
There are those that say, nah, we're not interested, and it's okay, you know. So it's challenging because you guys come with your own expectations that we try and live up to. And also, I think it's a matter of just meeting each other halfway and trying to see where we can get the synergy. Obviously, there is other things, obviously, that we try and negotiate with you. We would ask you sometimes like, no, I can't do that, or I can't do that. What I normally do, I try and work with you based on what you are comfortable with. You know, I don't want to put you out of the way you speak to your audience, the way you relate with your audience. For me, I find that is important so that it's genuine. I don't want it like it's a selling thing. You are selling to people. It should just be a lifestyle, guys. I've started this journey with Clinimed, and every once in a while you'll see me getting there, doing this, just so that people don't see it as, what is that? You're going like this, and all of a sudden, you know.
And also, I got a lot of comments, I think on the first video that I posted after I visited your clinic, where people were saying, we know for a fact that with you, you will be very much honest. We know that whatever the results are going to be, whatever it is that you're going to experience, you're going to be honest when it comes to you sharing the experience with us. And I think that's what I want us to get into now when it comes to the process of weight loss. Because obviously as people, you work with people on a daily basis, and sometimes you can be rooting and vouching for somebody, but they don't quite get to where you are hoping that they will get, you know? Let's talk options when it comes to things like weight loss. When I'm coming in now, I'm saying, the only thing that I will be saying to you is, Doc, I'm depressed, I'm overweight, I don't know where to start. How do you figure out what works for who and?
Okay. So what is important is that consultation that we have with you.
Okay.
And in that consultation, we are going to establish quite a few things. Number one, we'll establish you as a person. I think for me, it's important to understand the patient, because the patient is the one that will tell you all this information that you're dealing with. And the more we interact with you, the more we get that information. So your age matters. Your work matters. Your stress level matters. Are you sleeping at night? What are you eating? Do you drink alcohol? You know, we need to understand you as a whole person, so that at the end of the day, we can establish you don't need to do a daily injection because you travel a lot, you are forever on a flight, or you are somebody that likes going out, you want to have a social life, and we try and find a workable thing for you. I don't want patients to feel like they are on a diet.
Okay.
I don't want that, because I've spent all my life being on a diet. And it was a disaster, you know, because I would be in and out of a diet and I would never lose weight. And I was like, Kandi, what am I doing wrong? Even as a doctor, because I've got my own story of how I lost the weight.
Yeah.
And once I realized that it needs to be a lifestyle, then it changes all your life. So it's not like now December, then I'm indulging as if I get it. That's what the dieting yo-yo mechanism does to you. Highly December, you're like, okay, now it's time to have fun, and you're eating everything without, because then your mind tells you, dieting, do relax. You know what I'm saying? So when you start understanding how this thing has to be a lifestyle, we're kicking out the diet out. That's why I tell patients, it's not even about the cake, the what. It's just about the control.
The portion control.
The portion control. You can still have a cake. I'm going to have my slice of cake on my birthday, you know. But the difference between now and before is I'm not probably going to eat
finish the whole thing.
The whole thing. I'll probably have 2, and my body will be like, maybe half a slice or whatever. And it will be like, it's okay. So that whole process is very important for us to understand. And also with the medication, because the medication makes you really don't think about food. Some of the patients, because they have such a strong relationship to food, it's amazing when you start taking that away. They feel very vulnerable, and it's very important to understand and to make it clear to them. Remember, Sisi, the food is not gonna be there now. Now we have to find other things that are gonna make you happier, excited, because when they are going
it's an emotional
through
thing for them.
Exactly. When they are going through whatever issues, you know, umntana is somebody shouted at you at work, you're just like, you know what, let me just eat myself. Nobody's going, the food is not shouting at me, the food is like hosa baby. You know, so when we understand what kind of an eater you are, that makes the journey and the choice of medication important. Secondly, the amount of weight you need to lose. That also determines which medication we would put you on. Obviously, the budget as well comes into play, but we do have other payment plans that we can assist clients that don't have the amount upfront, like Pay Just Now, Pay Flex. They can use all of that to finance their weight loss journeys.
Oh, okay. I think now I quite understand why, for me, I think it was a little bit easier to let go, because I actually, I'm not a fan of food. Probably the reason why I was getting fat was because I can't eat like other people. I just wanna eat just so that I can get full, you know. So I don't have like that type of relationship with food. So I don't know if maybe we can talk about different people that come in and the different options that you have for them, based on the fact that their relationships with food is different. And the way that I want us to talk about this is based on my nagri. We can talk about me. It's fine, guys. You have to. You can know my business. My business is your business. It's okay. You know, because with me, I think the first type of medication that you administered on me was, we didn't even change. We didn't try to move to the famous ones that are now popular out there. So how does that now, let's say, for example, we had started with that one, and then you see that, no, the relationship is not working out quite well, and then you have to, what are the things that you look at? Because the reason why I'm asking this is because I remember with me, it was like, it was a shock for everybody in the office, how my body was just responding to first attempt, things are just working out.
I think also, when I started with you, I just don't remember what was your goal weight, what was your starting weight?
86 kg, and I was 96, not 86.
You were 96, okay.
Yes, I was 96, and I wanted to go down to 75.
Okay, so for me, what I normally try and do with patients is to say, let's have a first line medication and a second line.
Okay.
First line being just a simple GLP meds, which is what we put you on. Okay. And then second line being a combination of GLP-1 with GIP, which is the one that is popularly being spoken about. Munjaro, tirzepatide, that's the one. And I find that when we take that approach, it gives us more room in case we don't win with the second line. Because we've seen that we have had patients whereby, boom, we put them on this drug and they stall. The weight loss is not the way we were expecting it to be. And if you have started with the top medication, then you don't really, it's not easy to go back to the basic. So for patients that are not in a hurry, that we are going on a journey, that are like, it's quite a little bit more weight to lose. I would say anything more than 20 kgs, I would say, let's exhaust this first line first and know that, okay, in this, you have lost maybe 6-7 kgs and we can then move on to something else. And earlier on, when we started with the other medications, we did not have a lot of dosage regimen. They were very limited. So you can imagine the minute somebody stalls on the highest dose, there was not much that we could do. And most of the time, patients, because they are on injectables, they're not very keen to now do injectables and an oral every day. Because if we put you on an oral tablet, then you must take that oral every day while you are injecting every week. So it's also about the conveniency that you are looking for. Unless it's somebody that says, doc, I don't mind injecting myself every day, which is very few people. People just want to do it, once a week. And very soon maybe we'll have once a month. Can they do that for us? Yes. Once a month and your appetite is super controlled. That would be nice to have. So we look at your lifestyle, and how often. And also the most important thing is the follow-ups that we have with you in the clinic. I know sometimes patients think, nah, it's not necessary. There's a lot of people especially when I do my live sessions on TikTok, they would say, Head, why can't I just buy this and do it myself? But the more we do sessions with you in the clinic, there is so much that we cover with you, from how do you eat. If you're not eating, remember, this is not a starvation thing. We need you to eat. But the question is, what are you eating? Just that whole transformation of getting patients to eat in the correct way and understanding, if I'm eating this is what it's going to do to my body. And this is why I'm not seeing results, even though I'm injecting. And also, the more you use the medication, the more your body readjusts itself. So you'll find that if you were on a weekly, let's say you started on a 2.5 milligram of a certain drug, as time goes on, that 2.5 is no longer giving you the suppression that we need. And if you're doing it on your own, you won't know when is it the right time to either increase your dosage or stay on the same dose. And also, we've seen that when we combine the meds with IV drips, it helps patients from the point of their energy, their mood, because you are not eating as much, patients get tired. Your body is used to so much calories. Now, all of a sudden, you're only having this much food and your body just feels tired.
It wants to shut down,
Exactly. So we want to make sure that you are functional at work. We don't want you sleeping and headaches and dizzy and moody. Remember, when you are hypoglycemic, you become moody and irritable. Like when you are hangry, you become moody and irritable, and that's not what we are trying to do.
Okay. Speaking of being angry and hungry and moody, I think we need to, there's a lady, you see that lady who's sitting there? She's got so many things going on. And one of them, it's the myth that apparently one of the side effects of this type of medications is that you go blind. My sister, you told me that. I wanted to talk about the short-term and the long-term side effects of the medication.
Okay.
Yeah.
So the short-term side effects. Okay, remember again the importance of getting a proper consultation. One part of the consultation that we do is to do your bloods.
Okay.
To also make sure you don't have any other underlying diseases. So in people that just goes and get these things without being properly screened, they are the ones that in the long run, you hear they've developed X, Y, Z. I'm not saying that's the only thing that leads to those, but proper checking of everything. It's important. Also, in a case whereby somebody comes and we do the bloods and there's something that is a red flag, we still work with other doctors. We work with endocrinologists. We can always send you to an endocrinologist. We can send you to a physician to make sure that, everything is perfect. And we try and do your basic bloods.
Okay.
In your basic bloods, the bloods will tell us what is your vitamin D levels, what is your HbA1c level, what is your fasting insulin. Many patients are pre-diabetic and they don't know. They are literally at the edge of becoming diabetic and they don't know. And they have so much inflammation in their bodies that they don't know about. You wake up, your knee is sore, your shoulder is sore, you are puffy. That whole puffiness is because of the chronic inflammation that is happening in your body. So when we do all those tests, we are able to pick up and say, this is where we are with this patient. 2 months, 3 months, 6 months down the line, we can look at your blood work and say, okay, the CRP was high, now it's lower. This patient was pre-diabetic, the pre-diabetes is gone, meaning that they're no longer having a fasting elevated insulin in their system. So many other things, man, they just normalize the more patients. That's why we're starting to hear things like patients with arthritis, and the arthritis is getting better because of the anti-inflammatory effects that the medication has.
Okay.
When it comes to short-term side effects, you're looking at things like abdominal cramps, very rare but can happen. Nausea is very common. So what we do with all our patients, first time coming in, we will give you something for that nausea.
Okay.
Some patients have the nausea, some patients don't.
Like me.
You never had?
I think I had it. I would probably take it on the first day and that would be
And
it.
that was it.
Yeah.
So that is like that.
Yeah.
And then the other thing is constipation. I struggle with constipation. So, but what I think I had a talk with you about the importance of being proactive with it, making sure that you are going to supplement when you start. So because it's gonna happen.
Yeah.
Because of the way the medication works is that it causes a slowness in the way the food gets processed in your system. So one meal will make you feel fuller for longer. So you don't even think about food. And because it works in the gut, it tends to cause a little bit of gastric delay, and then you find that you are not as regular. So you need to make sure that your fiber intake is high.
Yeah.
You are eating vegetables with high fiber. You are drinking your water. Water is very critical in the system. Actually, some of the medications will actually make you a little bit thirsty.
Yes.
So you need to also learn to listen to your body and respond accordingly. When it comes to the long-term side effects, yes, they are there. Remember, with all medications, be it Panado, if you go and look at the leaflet, you will see all the side effects that are there. Yes, I think there has been cases that they have seen overseas of people that have gone blind. We have not experienced that in the clinics.
Okay.
We are also trying to understand that obesity is a chronic disease, just like diabetes.
Yes.
When you have diabetes, you go to a doctor
to
manage your diabetes. There's so much data coming to show that obesity needs to be a recognizable chronic disease whereby patients are properly managed and patients are on chronic medication. So some doctors say you choose which lifelong do you want to be on lifelong diabetic medication, or do you want to go on GLP medication as your long-term treatment? Obviously, we try and wean patients off the medication so that they don't have to be on it for life.
Yes.
Are the patients that are going to need to be on it for life? There might be patients that might need to be on it for life. Remember, also, it takes, for me, I think it took me like 20 years or 10 after my son. I could never go back to my body weight. You know what I'm saying? So that's why I tell patients, you can't come in when you have had and a lot of us after COVID, we struggled.
Yes.
Like you just put on about 20 kgs.
Yes.
Then they want to come in and lose the 20 kgs in
Now.
5 months.
Yeah.
You know what I'm saying? Of course, you will lose the weight, but you need to give yourself grace and take it one step at a time, because you will eventually lose weight. You need to let your body go through the process of losing the weight.
Okay.
Yeah.
This is the last one, Doc. The controversy around us finishing medication for diabetes patients, because I remember there was a time where there was a big hype about how
People are taking medication from diabetes.
yes.
Okay.
And also there was a shortage of the medication. So I just want to know, what is your take on that? Maybe that will give people some easy.
Yeah. Okay. Look, when the medication came, especially in South Africa, we only had Ozempic. So, yes, the notion and the guilt of that was there back then, because the shortage was there.
Yeah.
And when the medication arrived in South Africa, it was not, we were using it off label, if I may put it that way, for weight loss, whereas it's basically
only for diabetes.
that. Yeah. But with the newer ones, they are approved for weight loss. Yeah. So I think there's enough medication out there. And also at the end of the day, it's individualized care for you.
Yeah.
It's not about other people.
Yeah.
So you need to ask yourself, or if you are not treating yourself, where are you going in the long run in terms of your health? Because and also like that thing that we were talking about earlier on, of people thinking that this is you don't do anything.
Yes.
You are lazy.
It'll do the work.
It'll do the work. And when we had a conversation, you did say to me, Doc, I was working very hard.
Yeah.
In order for me to lose the weight.
I had to be disciplined.
You had to be disciplined. You had to think logically about what you are eating. You don't just get in a certain whatever place and buy and just eat without processing, or these chips, are they really good for me? Do I really have to be eating them now? Or do I have to finish the entire packet? I get and I'm good to go. So I think it's just about looking at your health as a person and individualizing it for yourself and saying, what is it that I want with my health?
Yeah.
Because if you've tried the whole year, 2025, iphelile manje. You probably have done benting. You have done a skipping challenge.
Even table.
You have wrapped your stomach with Vaseline and Vicks. You've tried everything. If you've tried everything, this is something that you can look at. And just for your health. Because, at the end of the day, you still want to run around with your kids when they say, Mommy, come catch a ball. Or you want to go, up the stairs without feeling like you're short of breath, or falling.
Like with my situation.
Like with your situation. And,
the one thing that is actually engraved in my heart, as you're speaking, is the fact that obesity is also a chronic condition. That you as a person, if you feel like you're not okay with watching yourself die with this chronic condition, then there's nothing wrong with you getting up and saying, I want to get help, the same way as a diabetes patient. And I think that on its own is enough to say, look, you don't have to listen to what people have to say. If you want to go lose the weight because you want to live long, then you should do it.
Exactly. I think that is the most important thing about the weight loss journey, how much it will change your life in terms of how you feel about yourself and the confidence.
Doc, I'm telling you, before I started the weight loss journey, I was no longer taking full body pictures. Mara, now every 2 minutes, hello, it's me and the grams now.
And it just does something to your mood. Like even when you're dressing up. For me personally, I love clothes, but I stopped fitting rooms. You would never find me there. But after you lose weight, you're just like, okay, can I try a small size? can I try a medium or a large or an XL?
Yes.
Because back then it was like, do you have double XL? And
You want the last number.
And certain shops, I mean, you would literally just stop buying there because they won't have your size.
Yeah.
So just that whole feeling of being able to walk in any shop and buy what you want, that's a nice feeling. Yeah.
Doc, thank you so much for coming in to educate us about
Thank you.
how we can continue taking care of our health. I don't know if maybe there's anything else that you would like to say in closing that you've left that I didn't ask.
So we also have our waist trainer.
Yes.
The thought behind the waist trainer was how much I saw many ladies, including me, how we struggle to exercise our core muscle. So that when you put on the waist trainer and you do it, because there's also that thing of people buying things and they never use it. So it's called So Snatched, because I wanted girlies to look so snatched, and also men can do it. So it's a waist trainer that you can wear when you exercise, when you are doing your walks. Remember, when you are on the program, we tell you, please move your body.
Yeah.
Because we don't want you to stop this medication and then the entire 20 kgs come back because when are you never. And remember, exercise is good for your mental health. So in order to do this, your mental health must be in a good space. And how you feed into that is by being intentional about, I'm going to go for a walk, I'm going to exercise. If kuna ma hikes, go for the hikes. Don't just sit alone and not be engaging with other things that are happening. So the So Snatched is there to assist. And then we also have bodysuits. So you can't go to work in that wrap. So you can wear your bodysuits inside. You will still feel snatched throughout the day. And then we also have just launched our range of multivitamins. As we go on and we are doing people's bloods, we realize there's so many, especially vitamin D deficiency, like with each and every other. My levels were sitting at 13. And I was like, oh my God.
Yeah.
And vitamins are important for our bodies to function very well. So that's also what we have in the clinic.
Okay. And I can attest to Ray, some of them you've prescribed some of them for me and they've been working. And also the one thing that actually saves me all the time is just the IV drip.
Wow.
My favorite.
Wow.
Yeah.
Wow.
But I think another thing now, let's focus on this one. You see, all those people are so scared of the injections, and they don't know that it's not painful because you put the numbing cream and then you do the injection.
Yeah.
So, but I just want to say thank you so much, Doc, for coming in to educate us.
Thank you for having me.
And thank you so much for, in as much as it is a business, it's not just a business. I see how you pour your heart into this thing. And how the whole room just celebrates when a person or a patient like myself is reaching their goals. I just want to say thank you so much for the work that you're doing and also not giving up, because all the positive and the negative that comes, sometimes it can really affect you and you're like, okay, maybe I should just stop this whole thing. But for you to keep going and educating us and reminding us, to one form of self-love is us taking care of our bodies, So I just want to say thank you so much for joining in. And we will see you. We will put all the numbers and everything. Yeah. So Bazalon, if you wanna contact Dr. Matho for whatever services, as you can see, I'm the living proof. You don't even have to go far. I've lost so much weight and I'm still looking forward to just my consultations on me working on certain parts of my bodies. Please also do reach out and also leave a comment in the comment section. Tell us what you think about today's episode. I will see you on the flip side. I love you. God bless you. Mwah.
Thank you guys for listening. Bye.